Have you ever heard of an ABN form? It stands for Advanced Beneficiary Notice. Sounds complicated, right? Don't worry, it's not as scary as it sounds. The ABN form is basically a heads up from your doctor or hospital. It's a way for them to let you know that Medicare might not cover a certain test or treatment. This could happen for a few reasons. Maybe Medicare considers the service unnecessary. Or maybe they think it's experimental. Whatever the reason, the ABN form is there to protect you. It gives you a chance to decide if you want to pay for the service yourself. You might be thinking, why should I care about this form? Well, here's why. Money. Imagine getting a big fat bill for a medical service you thought Medicare would cover. That's where the ABN form comes in. If you sign it, you're acknowledging that you understand Medicare might not pay, and you're agreeing to be financially responsible. On the other hand, if you don't sign the ABN form and Medicare denies coverage, you could be stuck with the entire bill. The ABN form protects you from surprise medical bills. It gives you the information you need to make informed decisions about your healthcare. There are a few different situations where a doctor might ask you to sign an ABN form. For example, you might need a certain test that Medicare normally covers, but your doctor doesn't think it's medically necessary in your specific case. Or maybe you're interested in a new treatment that's still considered experimental. In these cases, Medicare might not cover the cost. Your doctor will ask you to sign an ABN form to make sure you understand that you might be responsible for the bill. Remember, the ABN form is just a precaution. Just because you sign it doesn't mean Medicare will automatically deny coverage. So, you've been handed an ABN form. What do? First, don't panic. Take a deep breath and read it carefully. The form will explain the service in question and why Medicare might not cover it. It'll also outline your options. You can choose to sign the form and accept financial responsibility, or you can refuse to sign it. Keep in mind that refusing to sign doesn't mean you can't get the service. It just means you're not agreeing to pay for it if Medicare denies coverage. If you have any questions, don't hesitate to ask your doctor or a patient advocate. They can help you understand the form and make the best decision for your situation. Understanding the ABN form is crucial for anyone on Medicare.